So, someone was asking me about what my dog's dental routine is and how I clean my dog's teeth every night. So, normally I'm pretty good about cleaning their teeth at least once a day, but sometimes we skip a day or two here and there during the week. So, I'm just going to go through some of the equipment that I use. I got this off of Amazon, and it's basically just like a chemistry lab water bottle. It's basically for, rinsing out chemistry gear and things like that. But I got it because the nozzle makes it really easy to jet water in your dog's mouth without kind of freaking them out and making them feel like they're drowning. I use this to jet water mostly between the bottom front incisors where the teeth can get really tight and food debris gets stuck there a lot, or things that they chew on get stuck there. So it's almost like flossing for dogs, except they don't actually have to floss their teeth with floss because that would be a pain. But this kind of helps rinse some of the debris out. I also just will rinse the entire mouth out a little bit, and whatever comes off they'll swallow, just in case there's any kibble or treats or whatever stuck to their teeth. Kind of helps to rinse their mouth out a little bit beforehand and helps to keep their mouth lubricated for when I brush their teeth. The kind of toothbrush I use is actually just a regular human toothbrush. It's actually dirty right now because I just brushed your teeth. But it's just a regular human toothbrush. It's the soft bristles, so I don't get firm bristles because it will make your dog's mouth bleed, especially if your dog is not used to a regular dental routine. But Zoli's mouth is pretty sensitive anyway, so I stick with the soft bristles for all of my dogs. It seems a lot more pleasant for them. The kind of toothpaste that we use is CET brand, and I've had the best luck with this. I actually did some research about the different kind of enzymes that are best to use in a dog's mouth that help to reduce plaque and reduce the amount of bacteria. And I was really happy with this one. I also like Biotene. Biotene makes a veterinary gel toothpaste, and I think it's called Oratine for dogs. But that one actually has more enzymes in it. It has the same ones that this one has, and then has additional enzymes on top of that. The reason why I don't use the Oratine all the time is because it's almost like I think it's aloe based, so it has kind of an aloe flavor, and the dogs don't love it. I mean, they sit through it, but they're not excited about it. With this, if your dog is not used to having a regular dental routine, this will help you tremendously. It's meat flavored. My dogs look at this like it's a treat. They don't love the actual brushing action, but they want the toothpaste as a treat. So it makes them a little more motivated. It makes them a little more interested in the process. And that just kind of helps you a little bit, so you're not fighting your dog the whole time. At least they have something kind of pleasant to look forward to if they're going to be getting this daily maintenance on them. And then finally, I use a chlorhexidine zinc rinse. So this bottle is actually not the bottle that it originally comes in. I don't have the original bottle anymore. But it's called DentaHex, and that's the brand name. And it comes in a little squirt bottle. The liquid is blue. And it's a chlorhexidine zinc mixture, and so both of those things are really good at keeping bacterial populations down and keeping plaque formation down in the mouth. So this goes on every time my dogs eat a meal, whether I even brush their teeth or not. So the instructions are to apply this after every meal. I got this little bottle as opposed to using the original bottle because it has a spray on it. And the original bottle that the chlorhexidine comes in is really unwieldy, and I found that when I would put the solution in my dog's mouth, a lot of it would drain out and it would end up on the floor. And it's not cheap. I mean, it's like $9 for, a small-ish bottle, like, this tall. So it just didn't seem like it was really worth my money to be spilling it on the floor because they don't love the taste of it. It's kind of minty tasting, so they just sit there and kind of drool it out. But with the spray, I don't have to worry about that. So it goes right on. I can spray it as many times as I need to around their mouth. The nice thing about chlorhexidine is it stays in the mouth for a long time and it spreads out in the mouth really easily. So I don't really have to worry about getting it in every nook and cranny. I just try to get it, on both sides of the mouth and then at least once on the front of the mouth. So I'm going to kind of show you a little bit about how I brush their teeth. So I've already brushed Zoe's teeth just now, actually, but I figured she's here and she's being really patient, so I'm going to go through it a little bit. So the way I brush my dog's teeth is it's a little different for each dog. So you can see Zoli has some yellowing on her teeth, and that's mostly due to age. She's about 5 years old now, and it's been 3 years since she's had a dental cleaning. So there's bound to be some tooth staining, but she doesn't have any real plaque deposits, and that's because of our routine. So you can see like there's a little bit of scum down here. Sometimes this is the harder spot to get. And if I do find any kind of heavy plaque deposition, I do have a metal scaler tool with a fine hook on it, and I use that to just kind of take, so right here I actually need to clean, I'll just take it along the gum line and just kind of scrape off these little scales. So it's not the same kind of deep cleaning that your dog gets when they go under anesthesia. So those are still really, really important for general maintenance of your dog. And I do those every few years. But the scaler is nice for, you know, if your dog's teeth are generally pretty clean and you notice kind of some new plaque forming, it's nice to just be able to knock it off and have it not be building all that bacteria under the skin. So you can see how, you know, some of these bottom teeth where it's a little harder for me to reach with the toothbrush, or maybe I'm not paying as much attention to them as usual. Let's see if I can open her mouth here. You can see where that plaque is, her gum is a little red, right? So if I can barely touch it, if I touch it too much, it'll bleed. So that kind of irritation means that she has some plaque right under that gum line, and that fine hook scaler just helps me get barely under the gum line. It's not a deep cleaning, but it does help to knock off those scales, which lets you know, the rest of the cleaning procedure sort of clean in that spot. It lets the chlorhexidine reach the gum line. It lets the toothpaste work on the gum line, because otherwise that plaque is just blocking the action of all those materials. So in general, Zoli has pretty good teeth. The spots that I worry about the most with her are the front teeth here. It's a little hard to see. So you can kind of see how her incisors are a little gapped at the bottom. And she has some gum recession. That has happened a lot with age. So my solution has been, I use this water bottle, and I will jet water between the teeth after every meal, just to make sure that there's no kibble or food debris getting stuck in there, because, you know, it's that food getting stuck that ends up being solidified into plaque. The bacteria will just sit there and consume it and make plaque. So I like to make sure that I really get their teeth really clean and get everything out of there. So after rinsing their mouth out, making sure I flush everything really good, I put toothpaste on just enough to barely cover all the bristles. And I start with just one canine to the other canine. So I do top and bottom, and I just kind of gently, so just in this kind of motion, all along their teeth, all the way to the other side, top and bottom. Then, depending on how patient the dog is with me or the size of the dog, Zoli's really, really patient. So it's a lot easier for me to handle her mouth than maybe most dogs. I also will clean behind the bottom teeth, and she doesn't love this, but she will tolerate it. So you can see how there's a lot more plaque behind the teeth, right? So things get stuck there, and I make sure that I always really clean, because it would be a lot worse off if I wasn't. So I will kind of hold my hand. I know, sweetie, it's annoying. So I will kind of hold my hand in her mouth a little bit, just kind of gently, just to keep her mouth gapped, and then I stick my toothbrush down there and just kind of brush in this direction, so back and forth. That way the bristles are kind of running through those bottom incisors, and I'm able to reach the back of those bottom canines where a lot of plaque gets stuck. So that's the first kind of toothpaste set. The next, I'll put another strand of toothpaste, and I'll work at the back here. And so again, it's just kind of a gentle up and down kind of circular movement. I make sure that I open her mouth a little bit, so I just kind of wedge my fingers in there and just gently pry her mouth open. So you can see all these teeth back here near my thumb. If I let her have a full scissor bite, all those teeth get missed, and I'm not actually brushing along the gum line. So I have to make sure that I do separate her teeth a little bit so that I can actually reach back there really well. So using the same strand of toothpaste, after I get the molars, I'll kind of work up here near the premolars, and I just kind of gently run back and forth like this. I don't really worry about getting the backs of those teeth. Sometimes I will brush on the inside of the mouth, kind of where my finger is heading now, and I'll brush the back of those molars, because they are really large teeth, and it's, you know, it is a prime space for bacteria to grow on the back of those teeth, so I like to really make sure I get in there. And then after that, I just do the exact same thing to the other side. So I have, you know, canine to canine, up and down, the back of the bottom incisors, then premolar to molar, and then premolar to molar on the other side. And then when I'm done with that, I leave the toothpaste on. I don't rinse it off because dog toothpaste is safe for them to swallow. And they like it anyway. It's meat flavored. You can see she's kind of licking her toothbrush now. She says, I really like this. So after that, I use my chlorhexidine rinse, and we use it more like a mouthwash, I guess, that you leave on. So this is called a snoot spray bottle or something. It's really for like nasal cleaning, something like that. I got it on Amazon, and it came in a pack of 2. But you just press down on this, and I'll show you kind of, I'll do one little spray. She just got some, but it's not a big deal. So it just like that, nice and gentle. And they don't love the taste of it, it's super minty. But I'll do, you know, 1, 2, 3, 4, 5, and then 1 in the front, and then 1, 2, 3, 4, 5 on the other side. That way I know I'm getting enough in there, and it's really, really covering everything. So that's about it. That's our daily oral maintenance routine with my dogs. Obviously, my smaller dog, he is 4 pounds. He does not get nearly as much maintenance. For him, it's a quick and dirty back and forth brushing. I might try to part his jaw and then get the back of those bottom incisors a little bit, since incisors are really, really prone to falling out or getting really rotted in small dogs. So I like to make sure I pay a lot of attention to those. And then it's pretty much the same for my poodle. Greyhounds and Chihuahuas, which are what these guys are really prone to dental problems, so I have to make sure I really keep up with their dental routine. But my poodles don't tend to have any more dental issues than other dogs, so I still do the daily maintenance on him. He gets a quick brush, and he gets the mouthwash. I rarely have to scale him at all. I really don't have to make sure that I brush him every single day, or else it'll get bad. With these guys, if they miss 2 or 3 days in a row, you can tell. It is very noticeable. The plaque builds up, their breath starts to smell awful. If it goes on long enough, their teeth will start to get wobbly until, you know, you scale off that plaque and clean everything out really good. And obviously, if it gets bad enough, then they do need a very deep cleaning. And I still do routine dental cleanings every few years for my dogs. But with general maintenance, it's easy to avoid having to take your dog in for surgery every year, or even more often, depending on how severe your dog's mouth is. I don't like putting my dogs under anesthesia if I don't need to, and I'm more than willing to go through the extra effort of cleaning their teeth just to make sure that I don't have to do that. So that's it. I got some people who asked me what my dental routine is, and I just wanted to make sure I showed you guys everything. So that's all.